Hello, future nurses. It's me again, Nurse EJ, and welcome to Nursing Talks. For today's session, we will be discussing a significant health concern in the Philippines, with a high prevalence of calcium deficiency, over 95% of adults, and rising fracture risks among the elderly. Key statistics indicate that 38.8% of Filipino women and 30.7% of men are at risk, with the number of Filipinos at risk projected to reach 10.2 million by 2050. Okay, future nurses, let's talk about osteoporosis. It is a long-term condition where bones become thin, weak, and brittle because bone density decreases over time. Normally, bones constantly rebuild themselves. In osteoporosis, bone breakdown happens faster than bone formation, causing bones to lose strength. As a result, even minor falls or simple movements like bending or lifting can lead to fractures, especially in the hip, spine, and wrist. It is more common in older adults, particularly postmenopausal women, due to decreased estrogen levels. Now, future nurses, let's tackle the common causes and risk factors of osteoporosis. Number 1 is aging, especially greater than 50 years old, because bone density naturally decreases as people get older. Second is female sex or postmenopausal women, because after menopause, estrogen levels drop. And as we all know, estrogen helps protect bones, so lower levels increase bone loss. Another is family history. Genetics can influence bone density, and this increases the fracture risk. Also, patients with low calcium and vitamin D intake. Calcium is important because it strengthens bones, and vitamin D helps the body absorb calcium. Sedentary lifestyle is also a common causes and risk factors of osteoporosis. This is because when a patient lack of weight-bearing exercise, it will weaken bones over time. Next is smoking and excessive alcohol intake. These interfere with bone formation and calcium absorption. Long-term corticosteroid use, medications like prednisone reduce bone formation and increase bone breakdown. Lastly, small body frame. People with smaller, thinner builds have less bone mass to begin with, and these increase fracture risk. Overall, osteoporosis develops when bone loss exceeds bone formation, especially in individuals with multiple risk factors. Okay, future nurses, here are the common sites of fracture in osteoporosis. First, hip. It is one of the most serious fractures. It usually occurs after a fall and may require surgery. Hip fractures can lead to loss of mobility and increased complications in older adults. Second is spine or vertebral compression fractures. These can happen even without a fall. The weakened vertebrae collapse, causing back pain, loss of height, and a stooped posture or kyphosis. And last is wrist. Often occurs when a person tries to break a fall using their hands. It is commonly seen in early osteoporosis. Are you still there, future nurses? We are done with the common causes and risk factors and common sites of fracture in osteoporosis. Now let's discuss the signs and symptoms of osteoporosis. Osteoporosis is known as a silent disease because it usually has no early symptoms. Most people only become aware of it after experiencing a fracture. Common signs and symptoms include back pain, often due to a vertebral compression fracture when weakened spinal bones collapse. Next is loss of height. This is because of gradual decrease in height over time from repeated vertebral fractures. Third is stooped posture or kyphosis. It is a forward bending of the spine caused by collapsed vertebrae. And fragility fractures. These are fractures that occur from minor trauma, such as a simple fall, bending, or lifting. Now, future nurses, let's move on to how osteoporosis is diagnosed. Osteoporosis is diagnosed primarily through a bone mineral density or BMD test using a dual energy X-ray absorptiometry or DEXA. A DEXA scan measures bone density, usually at the hip and spine, and compares it to the bone density of a healthy young adult. The result is reported as a T-score. So, how does they interpret T-score? The lower the T-score, the weaker the bones, and the higher the risk of fractures. Negative 1.0 or higher is normal. It means bone density is considered normal. Negative 1.0 to negative 2.5 is interpreted as osteopenia or low bone mass density. It indicates a risk for developing osteoporosis. Negative 2.5 or lower is interpreted as osteoporosis. Bone density is low enough to be diagnosed as osteoporosis. Management of osteoporosis. We will divide the management into two: lifestyle and medications. Let's start with lifestyle modifications. First is adequate calcium intake. A patient must have 1,000 to 1,200 mg per day of calcium from diet and supplements if needed to support bone strength. Next is vitamin D supplementation. As discussed, vitamin D is essential for proper calcium absorption and bone health. Weight-bearing exercises. Activities such as walking, jogging, dancing, and resistance training help stimulate bone formation. And also, avoid smoking and excessive alcohol because both accelerate bone loss and increase fracture risk. Now, let's move on with medications. Bisphosphonates, like alendronate, are the first-line treatment because they reduce bone breakdown by inhibiting osteoclast activity. Next is selective estrogen receptor modulators, SERMs, because it helps mimic estrogen's protective effect on bones. Third is hormone replacement therapy, or HRT. This is given and may be considered for selected postmenopausal women. Also, denosumab is given to decreases bone resorption by blocking osteoclast formation and function. And teriparatide, this is given to stimulates new bone formation, typically used in severe osteoporosis cases. Management aims to prevent fractures, maintain or improve bone density, and enhance quality of life. Early treatment and consistent management significantly reduce the risk of fractures. Okay, future nurses, are we still on track? Now let's tackle nursing considerations in osteoporosis. Since management is long-term, nurses play a vital role in prevention, education, and early detection of complications. First nursing considerations is promote fall prevention strategies. That includes ensuring a safe home and hospital environment. We need to educate family members to remove loose rugs, have adequate lighting, and install handrails if needed. Second is encourage mobility and safe exercises. Under this, the nurse must emphasize the importance of promoting weight-bearing and muscle-strengthening exercises as tolerated. Also, avoid high-impact or spine flexion activities that increase fracture risk. Third is educate on medication compliance. This step is absolutely crucial for successful treatment. We need to make sure patients understand why it's so important. It really makes all the difference. First is we need to teach correct administration. Emphasize the importance of regular intake of calcium and vitamin D. Discuss possible side effects and when to report them. And last is monitor for fracture signs, such as sudden back pain, loss of height, limited mobility after minor trauma, swelling or deformity of affected limb. Nursing care focuses on preventing injury, promoting bone health, and improving patient safety and independence. And there you go, future nurses. That's osteoporosis. Again, thank you for watching, and see you on my next lecture. Don't forget to like, comment, and subscribe.